and everything. So to be able to say, yeah, of course I would believe you. Why wouldn't I believe you? I think is like one of those moments where it's like I can reinforce that you're a
Hmm.
trustworthy person, you're a believable person, um,
Hmm.
and I think that that's
Exactly.
important.
Know what those moments are either, right? You never know what those little moments are going to be that seem insignificant to us as an adult and are not insignificant to them as, and I don't think it's always just a parent-child thing.
Hello, everybody. That was just a little tidbit from Mike Miller about kind of the moral model as we were speaking about the stigma that surrounds addiction still to this day. We started this episode with the intent on rounding out our four-part series on trauma therapy. The whole conversation around stigma, as it tends to do, kind of got carried away at the beginning of the episode. So we end up talking a lot about that and getting into more of the trauma therapy. So now we're going to have to do a fifth part on trauma therapy, but I'm okay with that. So on that note, the title sponsor for today's episode is the Yatra Centre, where Mike Miller is the head clinician and co-founder. The Yatra Centre is located here in Krabi, Thailand, where I reside. And for any of you that haven't been paying attention this far, thank you for dropping in. And my journey started when I went to the Yatra Centre back in November to address some of my traumas that have been holding me back in life. Both the ones that were, the big T traumas faced while I was in active addiction, and some of the violence and just kind of crazy things that happened back then, but also some of the underlying traumas that led me to addiction in the first place. They are a holistic experience on a level that is hard to verbalize. Tai Chi, yoga, mindfulness, ice baths, meditation. That's all happening outside the therapy rooms with Mike himself or whichever therapist you end up with. There is inside those rooms, there's CBT, cognitive behavioral therapy. There's internal family systems therapy. There's EMDR therapy. There is so much going on there, guys, and it's definitely worth, I should say, your time to take a look at if you've got some traumas that are holding you back. They offer some online services as well. Of course, it's a residential treatment program here in Krabi. You just might be surprised at the cost when compared to residential programs in North America and Europe and the like. So check them out, guys. They are a clinic run by clinicians, not a business run by businessmen. And they know that where addiction is a smoke, trauma is fire. You can find more at www.yatracentre.com. That's YATRACENTRE.com. And here's your show. Hello, everybody. Watchers, listeners, supporters of all kinds. Welcome to another episode of the Weekend Ramble on the Ashes to Awesome podcast. I'm your host, Chuck LaFlange, checking in from Krabi, Thailand, halfway around the world in Calgary, Alberta, Canada, is my lovely co-host, Dr. Lisa. How are you doing today, Lisa?
I'm very good. I'm having a good morning, having a good day. The sun is shining.
What's the weather doing out there these days?
Nothing like it was a few weeks ago. It's like -5 or something. So it's very tolerable. I know to you guys in your +30. But for us, this is not bad. This is not bad. We'll take it.
On that note, our guest today is Mike Miller. He's returning back to round out our series on trauma treatment from, like myself, Krabi, Thailand. How you doing today, Mike?
I'm good, thanks. It's -5 and everything's all right. It's good. Wrapping up the day with a good conversation with good people. So about stuff I care about. So yeah, it's all right.
Yeah. It's 29 degrees here right now at 1 o'clock in the morning. So yay for that. Haters gonna hate. I don't know what to tell you, Lisa. I don't know what to tell you. So yeah.
I'm very jealous. I hate the cold. I hate winter. If I could limit snow to the week leading up to Christmas, and then other than that have it be 30 degrees every day, I would take it in a heartbeat. So
Yeah, it's all right. I mean, I get sunburned really, really fast because I'm super, super white. But I love the light quality of sunny, hot days, blue skies. And, people say, oh, you've been in Thailand for a really long time. Are you used to the heat? And I say, well, I'm used to being hot. And so I'm in air conditioning a lot, or I get overheated and then my brain doesn't work right. It's like I really lose cognitive function when it's that hot. But with air conditioning, everything's quite tolerable. So yeah, it's all right. Better than freezing.
Yeah.
Every day.
Yep.
Every day it is better than freezing. Yeah.
And I'm trying to think, when you were here, what time of year were you here? Can't remember now.
September into October, beginning first week of October. So it was still quite warm. But when we actually like bought some out like some heavier gear when we went whale watching, and also I had like a hoodie to go up to, like, in Canmore, going up to the mountains and stuff, and we went for a little hike, and I was like, why did I bring this sweater? Like, well, I think everything's going to be cold compared to here, but it wasn't cold.
Hey, listen, so coming into to the recording here, and I mean, I think it was yesterday morning for me. It might have been morning for you, Lisa. Oh, I guess it was morning for you because you're on your way to work. So it was last night. It was the start of my day because I just woken up, though. You called me about a situation that you'd been a part of. I would call it a situation. It's sort of negative connotation to it, but a story that you were telling me, and I want to take a minute to acknowledge that. And you know what? Maybe it's a little bit of ego in there for some validation, but I don't think that it's necessarily a bad thing this time. But you told me about a friend, and of course we have to keep this as anonymous as humanly possible. So a friend in your social network somewhere that had reached out to you, I think originally saying that it was about a friend with air quotes, and then sometime later coming back at you and admitting that it was about themselves, right? Mm-hmm. Can you tell us about that? Well, of course, maintaining that person's anonymity.
Yeah, I think so. And I think the reason I called you yesterday to tell you about it, and I actually think I said that to you. I was like, it's not about ego for me, but it's about validation of the value of what I think this show is doing. So yeah, it was a few months ago. Somebody that I know personally had reached out and just asking me some sort of generic questions about, a friend of theirs who I think had started sort of using some substances sort of more casually. But then, as we always say, right, why do people get hooked on substances? It's because of the relief that they get from some form of suffering that they're experiencing. And so I think it had started out quite innocently, but then had provided that relief to some things that they were dealing with that, that they hadn't been able to handle through therapy or get help with from medications. And then I think over the course of I think it's about a year, had found that they were needing it, that they couldn't control, their use anymore. And they were starting to, of course, see a lot of consequences to the using. And so initially it was this, these generic questions for some advice. And then more recently had reached out to me and were sort of passively making suggestions that kind of led me to say, like, are you the friend? And this person disclosed that they were. And this is somebody who I've known for years, but not somebody that I've ever spoken to about, my brother or just the way in which we know each other. That's not been something that's kind of come up. And I think what it is that I obviously share our podcasts and stuff on my social media. And this person is a friend of mine on social media. And I think had started to watch the podcast kind of out of curiosity. And so this is a person who said to me, like, no one in my life knows about this. Their partner doesn't know, their parents don't know, their best friends don't know. And they felt incredibly alone. And I think once they started to recognize that they were not in control of their use, that they couldn't stop, I think they were actually terrified, very afraid, feeling very hopeless, like there's no one I can go to, very ashamed, very fearful that if they went to certain people that there would be a lot of consequences from that, and ended up reaching out to me because of this podcast, said, that they were sitting there one night and thought, I can tell Lisa. And I just think that's huge. Like for me, I've said to a few people in the past week, if nothing more comes out of this podcast, because of my involvement, if this one person is able to get some help because of this, then it's all been worth it.
So the thing that I thought about is just to speak to, Chuck, even though I know you're kind of saying it a bit sort of joking or something about like the ego stuff and about validation, is like, well, to me, it speaks to what the hope is for this podcast, is that people end up getting some sort of answers and getting information that can be helpful, and, you know, being able to get some help, and whether that's provided from anyone who's sitting on this sort of panel or other members of the podcast team. But just the fact that it's in some ways inspiring people to reach out and get help from somebody, like, to me, that's the ultimate compliment for the work that you're doing. And both of you, I think, right? So I think that's huge.
Yeah. You know, we were talking about that. And for anybody that's listening and might be in that position or know somebody that might be in that position, the fact that she wanted to reach out in the first place is huge. The fact that like the kind of strength that took her, I think, is amazing. And so Ness, I don't know. I'm kind of at a loss for her, and like how proud, because it's tough when you're out there and you're in it, but it's in everybody's face. It's in your face, you know, and it's like, it's obvious to everybody in the world that you need some help, right? When you're one of those people on East Hastings, or you're, you know, myself, you know, homeless in Regina. But when you are suburban person, you know, all appearances be damned, and there you are suffering, and you have so much to lose by not reaching out. Reaching out is really hard to do, right? Really hard to do. So I commendable. And if you happen to be listening, you know who you are at this point in the conversation. I am so very proud of you. You know, keep that up, right? So yeah. So I'm trying to think of a nice witty segue into the whole trauma therapy thing, and I think right? I didn't have one ready to go. Normally I don't. I'm an off the cuff guy, so I don't have a witty one except to say, I mean, Jesus, like there's a lot of trauma there, right? I mean, holding those secrets in, you know, is that, you know, I don't know, Mike, speak to that. Save me, Mike, save me.
Yeah.
Hey, listeners, let's take a moment to talk about something crucial: carrying naloxone. This life-saving medication can reverse an opioid overdose in minutes. You might think, I don't need it, I'm not around opioids, but the truth is you'll never know when you'll be in a situation where you could save a life. It's easy to use, and many places offer it for free or at a low cost. So let's be prepared and look out for each other. Remember, you might not plan on being around opioid use, but you never know when it'll be around you, and you could save the life of somebody that is loved. This is Jared Blaine with the Blacklist Podcast, and remember, you are loved.
Well, I mean, I think that, you know, based on the context of everything that you just said, like carrying stuff, like, you know, I talk to clients about this all the time, and you know, like, this water bottle, this is not heavy, right? And I can hold it. And then what does my shoulder feel like in 10 minutes? Or what does it feel like in, you know, a year or 2 years or 10 years or 20 years? And this stuff, as we carry it, it starts to become quite debilitating for us physically, right? It has a knock-on effect on our nervous system, on our immune system. We start to feel more and more isolated. And then, of course, like, that will lead to probably, you know, speculating, but I think it's, in a general way, it would probably lead to more use. And you get stuck in that cycle, right? That, you know, it goes back to that sort of moral model of addiction, which is like, we're bad people. But we know that that's not the case, because whenever I speak to my clients and they say, you know, oh, I'm a terrible person because I was keeping these secrets, my response is always, oh, good. And they say, what do you mean good? And I say, well, a terrible person would never say that. So it's not a moral problem. And the evidence is every single person I've ever worked with has guilt and shame about their behaviors to facilitate addiction, you know, for whatever reason. So, you know, keeping secrets is going to lead to more and more shame because you're living in conflict with your values. And then that shame is going to lead to more and more need for relief. You know, and it's more use and more shame and more use and more shame and more fear and more isolation and, you know, more anxiety, because, you know, it just goes on and on and on, right? So to be able to actually say, I'm getting off of this like merry-go-round of insanity takes so much courage, because, you know, you said, oh, there's so much to lose if you don't reach out for help, but there can also be a lot to use if you do reach out for help. Because you don't know what people's responses will be. You've never done it before. There's all this fear about, like, will I be rejected? et cetera, et cetera. So it's like, it really feels like a lose-lose proposition. It's like, I can't go on using, and I don't know how to move forward in a way where I'm getting honest about it, because I'm so afraid of what the consequences will be if I actually do get honest. So it's like, yeah, it's a super, super scary position to be in. And I know I lived with, for all intents and purposes, a common law wife. We lived together for about 6 years, and I was using behind her back. But she did know about using at one point, and then then I got clean. And then when I would relapse and use again, I wouldn't tell her about it. And I would carry this burden. And it really like put a huge wedge in between us, because here's this person who's supposed to be like my single biggest source of support in the world that I can turn to, because we're partners and we're going to spend our lives together and all of that stuff that goes with that. And all of a sudden, like, I can't even be honest about the pain and anxiety I'm experiencing every day. Is like a really tough situation, right? And it feels super isolating. So yeah, I applaud anyone that can step up at that. Like, it takes so much courage it's kind of that like stepping off the cliff thing, right? Like, you literally are just stepping off this cliff and going, I hope everything's going to be okay.
Kidding, eh? I'm kidding.
I think like something I don't know if we've ever been explicit about, but is that whole relationship between, if you feel shame for things, and I actually had a similar conversation to that effect, is it does speak to the fact that you do have good morals and good values. Because if you didn't, you wouldn't give a shit.
Yeah, you'd be a sociopath.
Exactly. Right?
100%.
Oh,
Mike, actually, you interjected
stealing
on one of my
from people
Facebook
and
posts
stabbing
about
them in the
that.
neck is okay.
Yeah. Yeah, right.
Probably.
Yeah, you did. And it was a really well worded response to because I think you kind of went in with what I could be considered almost a Ryanism, if you will, with kind of a larger, kind of more intellectual, abstract idea, and I asked you to kind of dumb it down. So, not that it was that hard of a thing to understand.
$20 words.
I feel like I did not see that. I did not.
No. Oh no.
I did not see this post. Do you remember what it was, or what it was?
I don't remember.
I don't.
Oh, the real moral failure is treating it like it's a moral failure, right? Moral shortcoming or whatever, something like that. I mean, yeah, something to that effect, anyway, right? And then Mike jumped in with,
okay,
yeah. I mean, there's a lot of names and content to keep up with, so I understand.
I hesitate.
I missed that.
Well, and I hesitate to weigh in on anything that can be like strongly opinionated on either end of things, because either people agree with what I say and then I don't need to, or they don't agree and you're never really going to convince them anyway. So like social media is a thing where I'm like really gun shy about wading into that stuff, knowing that I'm the face of a trauma center, so I can't like get triggered and sort of like engage with people in a way that's not representative of how I want to be in the world and how I want clients to see me. Even though like on Facebook I have a fake name and I don't let clients find me, and my privacy settings are really high, I'm still like hesitant. But that probably would have resonated with me quite a lot, because I rail against the moral model of addiction all the time, because I think it's bullshit. And it's, even though, and here we have a member of the medical community, and it's funny, I interviewed a nurse today to come and work at the center potentially, and we were talking about like how we see addiction. Even though we're not an addiction treatment center, we see addiction as a symptom of trauma all the time. And I was talking about it, like even in the medical community that's supposed to view things from a medical or disease model, there's still the moral model in it where people like, oh, you're going to be med seeking, you're lying, you're manipulating, like the moral model is baked into society so deeply that even the medical community that's supposed, and not everyone, obviously, present company excluded for sure, but it's just so prevalent, and it pisses me off, because you're already feeling so isolated and you're already feeling so much shame about your own stuff that I don't need to be shamed by someone else for the fact that I'm not well, right?
And I noticed that particularly, like if somebody is admitted to hospital and they one of their primary struggles might be addiction rooted or related, and then it's like they get a headache and they're like, I have a headache, and they'll almost over justify that, like, like I'm not asking for like, can I just get it like a Tylenol? But it's like seeing the way that they'll ask. It's like they're aware of and worried about and fearful that I'm going to be like, oh, like, you're opiate seeking, aren't you? And they're like, I like just an Advil. Can I just get an Advil? You know? Yeah. And it's sad. It's really sad.
Well, I've experienced that. I've experienced that where I worked with an addictions doctor that you and I both know, Lisa. I worked with him,
Oh,
and
yeah.
I had broken ribs. I went to go see a punk rock show, and I was at the front against the wall, and I got kind of stampeded from behind and broke my ribs.
Oh
Yeah, and
my
I'm too old for
gosh.
that shit. And so I broke my ribs. And I went to him. This is a professional that knows me, that I work with, who's known me since the day I got clean, and I'm like justifying why I want some medication for broken ribs so I can go to work with him. And yeah, it's I remember getting drug tested at a workplace and being scared to death that I would like pee hot. And I was like, but I'm clean, and I know I'm clean, and I've been clean for years, and I'm not going to pee hot. And
Yeah,
like,
isn't that crazy?
and it's all because of back in the day, I would have been guilty of something, not
Hmm.
because I'm a bad guy, but because of all the stigma and lack of resources and lack of supports. You are left to your own devices and you have to do shady shit, which is also what supports the moral model, is that there's a lot of crap behaviors that comes with addiction, not because people are bad, but because they get forced into it. And there's a lot of systemic stuff at play in that too. But yeah, I always, there's an old saying, like if you lose your wallet, an alcoholic uh, would steal it, and an addict would steal it and help you look for it, or something like that. Like, and
100%.
that's kind of,
Yeah. True story.
I think I've
Right.
told the story on this show, right, about my brother and the vanilla bottle. Have I told that story?
I don't think so.
I haven't heard it, but
Let's
So
hear it.
this was 20 years ago or 20 something years ago. Um, and I was in grad school at the time, and my roommate when I finished undergrad had decided she was going to move in with her boyfriend, and so I went into grad school and decided I'm just going to go home. Like it's cheaper. So I went back to living with my parents for a few years, and my brother was also living there at the time. So we had like both been out of the home, and then we had come back into the home. And this was like in his early days, I think even before we knew actually. And I had gone and bought some stuff to bake. And I, got up the next day to go and bake these cookies or muffins or whatever the hell I was baking. And I'm like, where'd the vanilla go? Like, I bought vanilla. I bought it yesterday. I put it in the cupboard and it's gone. And I mean, now I look back and laugh about this, but like I remember my brother, and now I would be like, why are you so invested in helping me find the vanilla bottle? And he was like, oh, really? Like, I'll help you find it. And he was like up, digging through the cupboard looking for the vanilla bottle. Well, turns out he had poured the vanilla out and used the bottle to make a pipe. And but like he took the vanilla and then helped me look for the vanilla bottle. So, it's now I laugh about it. Like
Told
it's
you.
Just a straight line from one to the other, right? There's no metaphors. There's no nothing. It's like a straight line, right? There we are.
great. Yeah. Yeah,
That's funny.
totally.
Totally funny, right?
But another thing that sorry, go ahead, Chuck. No, I was just gonna say, just in kind of following to, what we're talking about, and something Mike just said brought this thought up for me. And I've seen this with my own brother, but then I also see it with just patients in general. Like when they're not judged and when they're met by a physician, and I say physicians because they'll see me in a physician role and then they'll tell me about other physicians they're working with, but they're shocked when they go to a clinic and they're treated well. And part of me is happy that they're getting treated well, but there's also a part of me that is incredibly sad that they're shocked that they're treated well, and I see a change, like, and I mean, in the work that I do, because I don't do a lot of outpatient work, so I don't follow patients longitudinally over time. But of course, in my brother's story, like, I've got the more longitudinal experience. And like, if I think back to ways he was treated at addiction medicine clinics, um, 10 years ago, to the way that he describes being treated at clinics today. And like I've actually, my sister-in-law had recorded the way an admin was treating them at a clinic up in Edmonton, somewhere between 5 and 10 years ago. And I
And
mean, the
these are the
way that,
people that are supposed to understand it, right?
yeah,
Like it's an addictions medicine clinic. Yeah.
right? And I've heard the footage of the way that they were being spoken to, you know, and it's shocking and sickening.
Yeah.
And again, thankfully, you know, today, like I think they've had better experiences, but it's, yeah.
That is crazy. It's something I've spoken about a few times on the show. Oh, sorry, Mike, if you don't mind. Was my trip to the emergency room with an abscess from injecting, right?
Yeah.
It was horrifying. This, and without telling the whole story, again, but you know, we do have new listeners every week. The triage nurse was yelling. Like, it sounded like yelling, of course. Like, I was, you know, hypersensitive to it, of course. But like, there was no doubt the entire waiting room could hear. When is the last time you injected methamphetamine? And then I was put into a jail cell style room, you know, and and I remember saying, "You're not closing that fucking door." Right? Like, nah, not happening. Right? I said, no, like, nope. Right? I know what that feels like. Right? And an hour and a half later, I left without treatment. To make a very long story short, I left without treatment. Right? And with the pain in my arm doubling every 20 minutes is what it felt like. It was excruciating, but I just could not handle it anymore. And I often say, if I was a more stigmatized, like I'm going to say this, it's not as bad as it sounds. I'm getting to a point. I'm a normal looking white guy. So somebody that's marginalized or I can only imagine how that experience, right? It must have been for them, or somebody that had spent more time in that life and being treated that way. And like how horrible. For me, it was like, you know, I still had a lot of intrinsic resource relative to some other people. And, you know, I was able to kind of stand up for myself and say, well, fuck this. But like somebody else who wasn't in that position, I can't imagine, right? Horrible situation there. And it really woke me up to what's going on in the medical community, right? You know? Yeah.
Mm-hmm. You guys know, I've talked about it with you guys personally. I don't know if we've ever touched on it on the show, perhaps. Like, I've done EMDR and trauma therapy with people on how they're treated by addictions professionals, from doctors to therapists to interventionists to all kinds of stuff. And these are the people that are supposed to get it, right? They're the people that are supposed to be like, oh, I understand. I have empathy because I understand what you're dealing with. And they still come at it, you know, like this belief that you know, if an addict's lips are moving, or how do you know an addict's lying, their lips are moving, and like all that kind of shit. And so when I went to treatment, and the place that I went to, for all of its failings, you know, like it's had some shortcomings for sure. One of the things that was really profound for me was that when I walked in, they said to me, while you're here, from this moment forward, your word is good with us until it's not. Like, doesn't matter what happened out there. Doesn't matter how full of shit you were out there, who you lied to, stole, like whatever. None of that matters. From right now, your word is good until it's not. We're giving you your word back. And I have that conversation with my clients all the time, because for me, it was really profound, because the thing was, my word wasn't good for that much before I got clean. You know, I had, you know, not because I was a bad person, but because I had a lot of bad behaviors to facilitate my using. People couldn't trust me. I mean, I didn't trust me, right? And so I always talk to clients about that and say, you know, from this moment forward, I'm just going to trust you until you show me that I shouldn't. And some people might, well, in the addictions world, some people might think it's naive, right? Like that I'm supposed to, and I tell people, I didn't sign up to be a parole officer, a probation officer, a babysitter, a jail guard, like none of that stuff like that. None of that's my role. And I also tell people, like, you know, and even though my job is to like read people, part of my job anyway is to be able to read people and attune to them. Like, you can fool me. I'm not going to come into this with a suspicious sort of mindset that I'm going to catch you doing something wrong. I'm not interested in it. When I was a medical monitor, and had, I would have medical professionals that, if they wanted to go back to work, they had to come and see me to do monitoring and, do biological testing so that they could return to the workplace if they had substance use disorders. And I had one nurse say to me, "You're trying to catch me using." And I said, "I'm a guy in recovery. I'm trying to prove that you're clean. Like, I'm not coming at it from that point of view of I'm trying to catch people out. I'm just not interested in it. And I would rather have someone fool me and, at that point we can adjust where the trust levels are at, than to come out and be like, I'm just not going to believe what you say, especially at a trauma center when how many times in your life, and we're just talking about the medical experiences with that stuff. How many times in your life have, because of your substance use or because of whatever, your behaviors are, people don't trust you, or maybe you just grow up in a family system where you're not validated and not trusted, and I'm just not going to replicate any of that stuff. So I think some people might think I'm naive in how I do it, after working with people with substance use disorders for 20 years, and I'm just like, what, for me it was hugely like this place I got clean at. I remember I went down to the office one day and I said, "Oh, we need paper towels in the paper towel dispenser in the kitchen upstairs." And the guy went, "Oh," and he like handed me the keys to it. And I remember being like, "Oh my God, nobody gives me the keys to anything." Like, what? And it was this like really, I mean, all that was in there was like cans of beans and shit, like it was like, and it wasn't a bunch of valuable stuff, but just the fact that they trusted me.
Not the keys to the med clinic yet.
No, that came later, which should never have. But no, like the thing was like, I wasn't gonna let them down with that. You know what I mean? Like it's not like it's not like I was thinking about pocketing the beans anyway. But you know what I mean? Like I was like, it was important to me. It was like, okay, you've given me my word back. Now that I have it, I'm gonna value it. And I appreciated it very much.
And this is like a silly side story, but just I feel like it, as you're talking about this situation came up in my mind, and I think it just speaks to how desperately as humans, not only do we want validation, but we want people to trust us and believe us, is with my 6-year-old. Like she was telling me a story this past week about something that had happened at school with like friends. And, I have a 6-year-old who's very expressive and talkative. Like I know everything that goes on in that school. I know every kid who's stepped out of line and gotten yelled at and all the rest of it, which is kind of funny. But she's telling me this story, and then she just looked at me and this is a little kid who I'm very aware to try to be like, to validate her, right? Like if she has an emotion, I validate the emotion. And she's telling me the story and she's like, "Mom, do you believe me?" And I was like, "Yeah, of course I believe you," And I don't even really know where that question came from. Maybe she was telling me a pile of bullshit and wanted to know if I was going to believe it. But again, I felt like the right answer in that moment was, yeah, like, why wouldn't I believe you? And it's just, I think human beings, I think we're all the same in a lot of ways, right? Whether you're 6 years old and innocent, or whether you're 46 years old and have done a lot of bad shit in your life, like we all are looking for the same things, right? So.
Yeah. Well, Virginia Satir would call it universal yearnings, right?
Yeah.
Love, be loved, respect, be respected, power, belonging, these kind of things. And I believe that's true. And I'm glad that was your answer to your kid.
Yeah. Thank you.
It's important.
I do appreciate your validation on that. Like, I've got a trauma therapist telling me I did the right thing. Thank you. It feels good. Yeah.
I was taught, because I've said like, I would be so afraid to be a parent because I'd be so afraid to like make a misstep or something. And I was taught, and I don't know where it's quantified or anything or how you would quantify it, but if parents just do good enough 75% of the time, that's good enough. Like it doesn't have to be perfect. You know what I mean? But I think that so many clients that I have, their parents will drop like what would to them would be like sort of a throwaway line to them. Like it's not this big impactful thing to them, but the client will sit there. And I've sat in a family session with a parent when the son has said, "When I was 9 years old, you said that thing." And the parent's like, "I didn't say that." But it's like informed his whole life and all of his relationships and how he can trust people and everything. so to be able to say, yeah, of course I would believe you. Why wouldn't I believe you? I think is like one of those moments where it's like, I can reinforce that you're a trustworthy person. You're a believable person. And I think that that's important.
And you never know what those moments are either, right? You never know what those little moments are going to be that seem insignificant to us as an adult and are not insignificant to them as, and I don't think it's always just a parent-child thing or a child-adult thing. But again, you just never know what's going to be really significant to someone. And actually, Chris, this makes me think of a story that you've shared about a situation where something was really monumental to you that your mom doesn't really remember.
Yeah. And actually, Mike and I talked about that in our session. And Mike, thank you. I know you would never bring that up. But I was just thinking, hey, take two. I've got a witty segue. Look at this. So if I can make up for earlier and not put the pressure on poor Mike here, but we did. There was one of those moments, Lisa, and I did talk about it with Mike, and I'm not going to get into that right now. This isn't the proper place for that. But yeah, something that happened in my youth. Mom doesn't even remember it, and I can't fault her for that, right? There was a lot of shit that happened in my youth, and if Mom remembered it all, she'd be a fucking client at the Yatra Trauma Centre in a hurry, I'm sure. So, like, I can't fault her for it. I didn't. And the more I embrace, recovery and my sobriety, the more I think about someone like, wow, hey, like, and I left home at a very young age. I gave her plenty, right? I gave her a 25-year-old worth of shit by the time I was 14 because I was a handful, to say the least, right? That said, back to the segue piece here. Back to Yatra. That's what we're here to talk about, Mike, right? Is Yatra. And I think I'll start off by like kind of my experience when I got there. And maybe this is a great way to do this. So because it's an easy way to explain how you do things, right? And why you do things the way that you do, right?
Can I take you up? Sorry. Can I take you up on the opportunity you said earlier to have a quick break because I'm hot? Because I just noticed something. I muted my microphone as I was coughing, and it comes up as the MacBook Pro microphone as I mute it. It's not on my AirPods. So I'm wondering if I leave and come back in, can I then set the microphone
This was the leather chair
and then I can
effect.
have my aircon back?
If I got to cut out that fucking leather chair noise through the first half of this episode, oh my fucking God. Okay, I'm going to tell Lisa about it here. So the episode Mike and I did where he's go ahead and leave and come back, or you want to hear this, right? Okay. I go to record or go to edit it, and all I can hear is that fucking chair. Through the entire thing, I can hear this goddamn chair so loud
really?
every time he moves, right? It was like plastic on plastic. It was just this horrible, fucking god-awful noise, right? I had to go through every second of the episode, and like I couldn't get rid of it as a background noise. Wasn't happening. There's no fucking way. So I had to go. It took me fucking hours and hours to edit that episode. So, and that's what it was. He was on his fucking laptop. And afterwards, he's like, no, I'm pretty sure. I'm like, no, something fucking changed, Mike. This isn't your first appearance on the app. Let me tell you. Something was very, very different. So now I think that the first half might be inundated with leather chair fucking noise. And if it is, I'm going to fucking cry because we didn't even start till 1 o'clock in the morning. So, yeah. Yeah.
Good thing he's worth it. He's worth the leather chair.
Yes.
See.
Holy shit, there's a difference, eh? And is your aircon on now, Mike?
It's just kicking on.
Oh, okay.
I'm just going to direct it.
Isn't that funny, though, that none of us thought it might have been what microphone he was using?
I think I might have.
Just automatic, right? Even when I came back in this time, it automatically connected to it.
Yeah.
So that's funny. Yeah.
Is it still there?
Tell me it's not still there.
Okay, stop talking. I'll let you know. Nope, you're good. Yeah, it's blinking. Yeah. Fuck's sakes. God, no, I'm so afraid of the first half now.
I'm just grateful I get to have the aircon.
I might have to move my setup into the bedroom because it's going to be a long night.
Live and learn.
I don't know. Yeah, I should have guessed that early on, right? Yeah. Anyway. So.
Well, we tried all the settings for the AirPods. It never occurred to me that it would be
had
the
defaulted to
AirPods.
the
Yeah,
MacBook
right.
mic.
Yeah, yeah. Oh shit! I thought I hit stop recording. I didn't. Okay, so I have to go back and find this voice note. Where's the voice note? There used to be a voice note button. They keep changing and adding features
Cat
to
wants
this.
in, cat wants out.
Mark clip. Oh, there it is. Okay. So I know where to go back. Okay, so we're about to speak. Okay. Are you ready to go?
Think
You're
you're
going to go
going
back
to
to the like segue thing.
Yeah. So when I got there, right? So, okay. All right. So when I got to Yatra, I mean, first, and I tell this kind of as a funny kind of anecdote from when I talk about my experience there. One of the first things said to me was, you don't have to worry about not liking spicy food. You're at a fucking trauma center, and lunch will not be stressful, right? But to me, and it is such a little thing, and maybe kind of a stupid thing to focus in on, but not really. Not when that's setting the tone for what's about to happen, right? And obviously, it's not a stupid little thing because it was impactful enough for me to have mentioned it 500 times. In the 2 months since I was there, and the 3 months since it was said to me, right? So, it does speak a lot to the experience. So right off the bat, I don't know how long it was before we had a session together, Mike, in your office. A few days for sure. I don't know how long for sure.
Yeah, I think you came in over the weekend maybe or something, but yeah, a couple of days.
Yeah. But right away, it's the yoga is kind of the first thing I experienced anyway. Which was, hey, when you're a middle-aged fat guy, that was pretty stressful in its own way, but not stressful. It was hard, and hard isn't necessarily bad. Let me tell you, yeah. I remember looking at, I can't remember who the fill-in, I can't remember his name.
That's that critical part.
Yeah. I'm sorry, I can't remember his name. Justin. I really like Justin. Actually, I'd like to get him on the show one of these days. Yeah, Justin. Yeah. I remember looking at him saying, like, "I am not your friend" on the second morning. Right when I got there, I'm like, "We're not friends. Like, don't think we are." And
was he the yoga teacher?
Actually, yeah, he was filling in for Carrie.
He was the fill-in.
Yeah, really great guy, like a great guy. Sidebar. Justin showed me a picture of himself while he was still using and drinking back in the day. And he was like 100 pounds heavier than he is now. He's a fat guy. But I remember looking at that and like, okay, get your shit together, right? Like if he can do this, if that's who he was then, you're no different. Just suck it up and start doing this thing, right? And I won't say that was the day that I started participating 100%, but it certainly got me a lot closer. And I still think about it now. Right? Because like Justin is ripped, right? He's in really good shape. He's a yogi, right? So like, he's a pretzel, right? With muscles. So like, right? Like there was a lot of inspiration that came from that. And I guess that speaks to the entire, and I guess that speaks to the entire the recovery thing, right? Because you need inspiration from people that have done it and whatever. But we're right away into the yoga, the mindfulness, meditation was all like the first couple of days. And Mike, if you can kind of explain why that happens, why it takes a couple of days to get into a session with you, and you've explained it to me, but maybe to the watchers and listeners, right?
Well, I mean, part of it comes down to scheduling, because if you happened to come in on a day when you were scheduled to see me, you would see me right away. But it's what would happen in that session and why. So basically, if we look, it's nervous system stuff, right? So this is a lot of what we do is informed by the polyvagal theory. So just for anyone who's listening who hasn't heard me ramble on about this stuff before, essentially, like, our nervous system is a system, and people don't, like, we say that, but we don't actually take it into consideration a lot. We think like that our body is one thing and our brain is a different thing. But when people are in heightened states of activation from trauma or chronic stress, and I mean, what chronic stress is usually is just the result of, I mean, the symptoms are the same, right? Anxiety, whatever. When our nervous system is hyper aroused, we don't necessarily have access to our cortex, because when we're in a stress response, that stress response is now, I'm not a neuroscientist, but I was trained by a neuroscientist, so I'm going to get this the best I can. The amygdala is largely responsible for the stress response, but that's in my brain. So if I'm seeing or hearing or getting some form of stimulus that's telling me that I should be stressed, that I might be in danger, like how does that message get to my body? Because when you think about what the responses are to that stuff, elevated heart rate, breathing is changing, pupils are dilating, hair standing up on the back of my neck, I'm getting adrenaline and cortisol flooding through my body, and a lot of oxygen into my blood, pumping to my major muscle groups so that I can fight or I can run, or, 1,400 changes in the body during a stress response. How is that happening? Well, the vagus nerve is a 10th cranial nerve, and it goes from our brain to essentially all of our organs. And it's why it's called the polyvagal theory is because there's two branches to the vagus nerve. One is what they call the old non-myelinated vagus, which basically just means like myelination just means it's like a coaxial cable, like it's like a nerve that's like wrapped in, I guess. But the old vagus nerve isn't myelinated, and all sort of animals have that, like even down to like lizards, right? We share that with like all kinds of different animals. And the myelinated vagus is one that is relatively new as far as evolutionary stuff. So, it's probably like a few million years old only or something, but we don't share that with other sort of like what people would consider to be lower animal species or whatever. But what it does is it sends messages from our brain, oh, this is dangerous, to like our kidneys, to the adrenal glands, release adrenaline. There's sensors in our lungs for it. They say, start breathing, get that oxygen in, and your heart speeds up, and it's like pound that blood out to your major muscle groups. And it's all messages that are sent through the nervous system, right? So if I'm living in a state of hyperarousal because I'm constantly in threat, because maybe where I live isn't safe in some way, whether that's physically not safe or emotionally not safe. Because when you look at it through time, the fight, flight, freeze response has been around forever, but it used to be for legitimate life threats, right? Like a warring tribe throwing spears at us, or a saber-toothed tiger at the cave door or whatever. Like when there was a threat, like my body needed to mobilize so that I could fight off that threat. Now here's what happens is all of that energy goes to survival, and our body shuts down other sort of non-crucial mechanisms during that survival time. So it's not going to waste any energy on things like procreation, it's not, or digestion. Why so many trauma people that have experienced trauma come to me and they go, yeah, I have irritable bowel syndrome, I have Crohn's disease, I have stomach problems. And it's like, yeah, when you're in a stress response, you've got food in your stomach and your body's saying, I'm not wasting energy digesting that right now. And it messes up the whole sort of system, right? That's a very simplistic way to put it, but it's really true. It's quite a common phenomenon. So it's all connected as a system. Nowadays, like that threat that we're perceiving might be like, well, I'm keeping a secret from my partner and they're coming in now. Oh my God, are they going to know? Are they going to see it? Are they going to hear it in my voice? It could be like, oh, I'm late for a deadline. It could be, how am I going to pay the rent? Don't get me wrong. That can obviously be a pretty serious threat if we can't pay the rent, but it could be like everything that can be from trivial stuff to not a warring tribe coming at us with spears. So we've never evolved out of that response. And if I'm sitting in addiction, the chances are that my nervous system is like pretty activated, either hyper aroused where I'm like an engine on, or hypo aroused where I'm like lethargic, don't have energy, easily overwhelmed, that kind of stuff. And if my nervous system is constantly in this like sort of state of arousal, then how am I ever going to feel safe and get well? And so then someone comes in and goes, oh, I don't really like spicy food. And to me, that's not a trivial thing. That is absolute safety, because it's one of your corest, most basic needs, is to be able to eat and feel safe and be cared for and know that we're going to take care of you and know that you're being heard and you're validated and you're important. So when you say, I don't want spicy food, it's like, okay, that person doesn't get spicy food, period. Like, let's take care of that. Let's let this person know that they're being cared for, because lots of times in their lives, potentially they wouldn't have been cared for by people who are supposed to be taking care of them. This goes back to the talk about the medical community. If I go there and you're a person in a position of power and you're supposed to be taking care of me and you don't, that's a massive betrayal. And it's a huge wound. And then, maybe my parents do that. Like, this could possibly come from like really early days, like, kids should be seen and not heard. Oh, don't be silly. You'll eat what I give you. Like, which I'm not saying there's necessarily anything wrong with that. I think part of it is the delivery and how it goes, where kids can get a message that they're not important. So when you walk in the doors at Yatra, you're important. Your needs are important. And it's not about my needs. I love spicy food, but I'm not going to make you like eat spicy food because I like it. This is like patient-centered care, right? Like, this is about what your needs are. So to me, that's not a trivial thing. That's a very big thing. Now, why do we go into the yoga and all of that, like, really quickly, in the mindfulness? So this autonomic nervous system activation. So this is stuff you can't control. Like, you can't think, I'm going to calm myself down. You also don't think, there's a threat, I'm going to get activated. This is your nervous system reading the environment for threats and then responding accordingly, whether you fight, flight, freeze, whatever. Like, you don't choose that. Your nervous system chooses that. It's autonomic, which basically just means automatic, right? The autonomic nervous system, the ANS, some people call it. There's a really good video on it. And because the vagus nerve is connected to all of your organs, including your lungs, the lungs are the only part of the autonomic nervous system that you actually can control. So if you're breathing longer exhales than inhales, so I always teach people 4-4-8 breathing. Breathe in for 4, hold for 4, breathe out for 8. Those sensors in your lungs for the vagus nerve are sending messages via that nerve to your brain that say, hey, look how chill it is. Like, look at how relaxed I am. There's no threat here. And it can, you slow your breathing, it slows your heart rate, and it can reverse that whole arousal cycle. So everything that we do that's sort of what people consider holistic and we would consider to be somatic, this is bottom-up treatment. It's using our bodies to change our brain. Breathing is like the ultimate hack for the nervous system. If we can slow your breathing and we can reverse that arousal cycle so that you can feel safe and calm in your body, your prefrontal cortex comes back on, and then you can sit in therapy sessions, including cognitive behavioral therapy. Like, a lot of places, even places that I've worked, like day one, they're getting into cognitive behavioral therapy. And it's like, your brain isn't even online yet. Like, that to me, it's like, there's an order of operations that we want to follow. First thing, safety in the body. All the trauma literature will tell you, you can't recover from trauma if you're not feeling safe in your body. You can't. If you're hyper aroused, you're not going to relax. You can't feel safe. You can't. Safety allows for proximity to others. Proximity allows for contact. Contact allows for social bonds. And social bonds are really important for us to be able to survive and thrive. And it's baked right into our DNA because, from ancient times, we know that we will survive better if we're connected to other people. So, that stuff's really important. So that is a really long, ranty sort of way that's all over the place to say, why do you do yoga on day one? Why do you do yoga in the morning, mindfulness in the afternoon? Like, why is there so much of that stuff? Why do you get group sessions of that? Why do you get individual sessions of that? Why are you doing breath work? Why are you doing progressive muscle relaxation? Why are you doing ice baths? People think ice baths are a weird thing maybe to have at the trauma center, but ice baths is another good way to hack your nervous system, because if I was to plunge you into the North Atlantic Sea, your brain is going to go, we're going to lose all of the heat from the warm blood in our body if we send it out to the extremities of our arms and legs and fingers and toes. So we're going to slow down that heart rate so we're not pumping all that warm blood through our body, and it restricts blood vessels. And so if we put you in an ice bath, it's sort of tricking your body into thinking, that you're going to be stuck, that you could become hypothermic. And so it slows down your heart rate as well. So it's another good hack. So all of these things are designed to regulate the nervous system so that then we can get the cortex back online, and then we can start doing the top-down therapies. And yeah, so that's basically a long way to answer your question of why yoga on day one.
Okay.
Sorry.
Go ahead,
And
Lisa.
even Mike, like, I mean, I loved all of that. You covered a lot of stuff in there, but even, not everybody has ice baths, right? But you can even fill a bowl, take a bowl that you bake your muffins in, fill it with water, put a bunch of ice cubes in there, and you can actually submerge your face in it.
Yeah, or a sink.
And that can, right? And that can also help to sort of regulate people who are super distressed. So for example, you can't engage in cognitive behavioral therapy if you're completely dysregulated, because you need access to your frontal cortex to do cognitive behavioral therapy. So if you're in this really emotional, dysregulated, it's just off the chart, you can't sit down and do a thought record. But that's where, if you can do breathing, if you have an ice bath, perfect. But if you don't, fill a bowl, stick your head in a bowl of icy water. And that can help to sort of bring you down to the point where you can start to access your frontal cortex. And
yeah, absolutely. Yeah, I always recommend either bowls or sinks of ice water if there are people not in care with us, because I do a lot of outpatient or online work as well, where people aren't in our care. Actually, Yatra exists because during COVID, I was seeing people online from all around the world. And I would say, it'd be really useful if you could do this kind of practice. And they would say, yeah, that's kind of a big ask for me because I'm like locked in my apartment. I don't have access to resources. I'm super anxious, trying to get the momentum to get me to walk out and get ice cubes and fill a sink, or, to put on YouTube and start following some beginner yoga course by myself is like so incredibly difficult and such a big ask. And that's why I said, when I got asked to go back and run the rehab that I was working at, I said, no, I'm just going to rent a facility, and everything that I recommend that people should do in conjunction with my online psychotherapy is, I'm just going to bring that right to your door. Because if you can't do it at home, you might be able to do it if it's literally delivered to your door. And that's sort of where Yatra sprung from, was to make it a more comprehensive thing to help people regulate the nervous system, to be able to participate better in a lot of therapies. Now, some of the therapies we do, like EMDR and IFS, aren't necessarily top down because there's somatic stuff involved in it. But it's still obviously one of our goals is to have people being comfortable and safe in their bodies. And from an addiction perspective, I don't know how many people I've heard, whether it's through my long time in Narcotics Anonymous or working with clients, one of the things people say is like, I just didn't feel comfortable in my own skin. And do you know what I hear? Oh, you have an aroused nervous system. And where does that come from? And that's, I was born an addict. I've always felt separate from, I've never felt comfortable. It's like, that sounds like trauma symptoms to me. And if it's been around for a long time, it probably comes from adverse childhood experiences. So it's really important to get that regulation going on out of the gate.
Mm-hmm.
Kidding, eh? No kidding.
And it just speaks to how holistic Yatra is in my mind. That's what I hear, right? Is about, because I think sometimes when people go see a therapist, it's like, it's treated like there's one thing. We're going to fix the one thing. But it is so much bigger than that. And so it just speaks to, I think, how holistic Yatra is. And also how it's really trying to get at the root of people's struggles. And it's also teaching them skills that are going to forever help them. Because I feel like even if you are somebody who had like a perfect childhood and then experienced a trauma when you were 40, and you are truly there because you had this one isolated trauma, I think having skills around, breathing and being able to regulate yourself, it's going to make your whole life better and easier, right?
For sure. And like, we know this actually, like if you think about through the span of your life, if you're watching media or if you've ever experienced it, anyone who's like, even if you're in sports and someone gets hurt or something, where they always say, okay, breathe, take a deep breath. Like it's the go-to thing that we all sort of like intuitively know helps people to like relax and calm down and everything. And yet it's not intentional. I think a lot of the times, like we don't go, oh, this thing that's free that I do all day, every day, and all night, every night, that I can just access at any time is actually super important and can be really therapeutic, because we don't learn any of that stuff, right? So yeah, I think it gets downplayed because it's not some magic pill. But the reality is, it's like regulating your nervous system allows you to feel safe in your body. And it's so, so important because so many people don't experience that.
It's the breathwork thing is funny. It had been mentioned to me, I don't even know how many times before visiting Yatra. Dozens, hundreds maybe, I don't know. Especially during that first year of sobriety before I got to Yatra, and PTSD had really started to take an increasingly big role in my life, it seemed, right? At least for the first 6 months. It just kept getting worse. Like it just wouldn't get better. Nothing does on its own, right? I try and tell myself that by never going to a doctor. Like literally never. If you ignore a problem, it goes away. That is not the case with trauma. It might be the case with diabetes. It's not the case with trauma. I'm kidding. It's the one thing
I was going to say, I'm not sure that's the case with diabetes.
No, I think so.
I'm just kind of, yeah.
Nice try.
When it comes with the trauma, though, it's one of those things that I wish I would have listened to much earlier on. And Mom, if you're listening to this, I know you will eventually. I know you were right. I was wrong. Okay. Because that's one thing Mom's been on me for years about was breath work, right? And she was right. She was 100% right.
Yeah.
And it's also the thing, and you touched on this already, Mike. It's free. You do it all day, all night. Now, after it's been 2 months since I left. 2 months tomorrow since I moved into this race. 3 months tomorrow or 2 months tomorrow? 2 months tomorrow since I got here. Since I moved into this place.
2.
And that is the thing that I find myself doing often and all the time. It's the easiest thing to take with you, right? I told myself I was going to do yoga on my own. Nah, that hasn't worked out, right? I told myself I'd figure out ice baths and I'd find a pool that I could go to. They don't really have public pools, and not that I'm aware of anyway. But I can breathe, and I can do that with intent, and I can do it often and as often as I like. And it is something that I've certainly taken with me, right? But, right. Yeah.
And you can do it in a room full of people, and you can do it like, it's not like some like, hey, first of all, I think I would definitely encourage you to continue doing the yoga. Get back into that, whatever that looks like. Come out to Yatra. You know, like once someone's been with us, we kind of say like, you're part of the family. We're not a service where it's like, oh, thanks for your money, time's up, get out. Like that isn't kind of how we operate,
what you say.
right?
I like your smoothies, right? Yeah, right.
Well, smoothies aren't included. No, just kidding.
Free yoga, but no smoothies for you.
Yeah. Well, smoothies are important too, right? Good, nutritious. That stuff is important.
Oh, good. Oh my Lord, yeah. I still haven't found a good connect for those.
I love them too. Yeah. You might have to make the drive out sometimes. But yeah, I think those practices are so important to carry forward. And I'm glad that you're doing the breath work, and you can do it anywhere. It's like, like I say, I encourage you to do the yoga, but like, if you're feeling stressed out, like in a bank, like what are you going to downward dog in the like, it's probably not going to be. I was just going to
say, middle-aged fat white guy doing yoga in a room full of people is going to get weird. So
I'm going to encourage you. I'm going to encourage you.
Yeah.
To have that critical part of you lay off the fat word.
Yeah.
If possible. Yeah. It's not kind to yourself.
I know.
And I understand
said it twice, and I was like, he's going to dial in on it.
When we have critical parts of ourselves that say that.
I know he's going to say it. I know he's going to.
But like the part is critical because it wants us to appear right. I have that part that says to me, oh, you're fat, you're overweight, and all that kind of stuff. And it's because it wants me to present well so that people can't judge me for my appearance and that kind of stuff. So that the intention is good. The application is unkind and can be quite hurtful, I think, sometimes. So we want to appreciate that part of you for,
Fair enough. Right.
you know, the work that it wants to do to protect you and keep you safe. It's just like, could we do it in a different way? Right?
Yeah. You're right. You're right. Of course you're right. We know that.
If that makes sense.
Of course.
Sorry to put you on the spot there, but I also want to point out that earlier when we were talking about the medical stuff, Lisa had said, like, a part of me wants to do this and another part of me wants to do that. And I was like sitting here going, the parts.
Well, there you go. Thank you for another bit of segue. Just so we can get back on track here. Because guys, it's been a while. We're not going to cut this off until we've covered what we want to cover. But we got to make sure that we keep it on track, right? So that's kind of the holistic part. I don't want to, because of the therapy, like the clinical therapy part is very much a part of this holistic thing that's happening. But so those are kind of the outlying, I don't know how you want to define that. Those are all the stuff that happens outside of your office. Let's say that, right? There's a lot of things that happen outside of your office.
Yeah, but they're core parts of the program. What I don't want to do is what happens a lot, people value sitting down and doing therapy with myself or another therapist as like, well, this is what I'm really here for. When if you look at it for me, it's like, but if you don't do that, then this stuff is going to be a lot less effective. 100%. It's a core part of the program that's equally as important. It's just, I'm the face of the place. So people kind of do the thing where they put me at the top of a hierarchy of importance, but you get 4 hours a week with me. You literally could get 3 hours of holistic or 4 hours of holistic stuff a day. Right. Yeah. So it's like, I'm a pretty small fraction, but also the psychotherapy stuff that we do in the office is really important, I think, because going back to the nervous system and the perception that our brain can perceive threats, why we don't do group therapy and why we don't do talk therapy is because our brains perceive threats when there aren't sometimes. And when I tell a traumatic narrative, my brain can perceive that as happening again right now. So, an example of that would be like a nightmare. I'm tucked in bed, I'm super safe, my brain thinks about scary stuff, and my body responds to it. And so when I'm telling traumatic narratives, sometimes I can activate my nervous system and I can get really aroused by that. And when people tell, stories of pain and stuff, like you can see them get dysregulated sometimes. And I don't mean just in a therapy room, I mean everywhere. Like you can see people, you watch interviews with people where they're talking about tragic stuff that's happened, and you watch them get dysregulated in the moment, and their brain can think it's happening again, and they can be like reliving that. And reliving things is a symptom of PTSD. So we don't do that stuff. With group therapy, think about like, if I don't feel safe to talk about my stuff, or I don't feel safe because in my family of origin, if you spoke up about things, maybe you'd get criticized for it or something. Now you want me to walk into a room full of people I don't know and talk about all my deepest, darkest stuff? Like that is not going to feel safe for people. And I've been in rooms, in rehabs, in group rooms where there's always someone who won't speak very much. And what they do, like I've seen clinical teams brand them as resistant, defiant. They don't want to engage, being called passengers in the treatment, and that's what it looks like externally. So I'm not like trying to blame it, but from the point of view that I have that's trauma informed is like that person just doesn't feel safe enough to engage in that room in a vulnerable way because they've probably been hurt by doing something. Like, they've probably become vulnerable in the past and it's been used against them, or they've been mocked or ridiculed, or they grew up with like, particularly men, big boys don't cry. You want something to cry about? I'll give you something to cry about. Feelings are for girls, work hard, play hard, like all the bullshit, toxic masculinity stuff that men get taught. Now I know women get taught things about women get vulnerable and then get taken advantage of in those ways too. So I'm not saying it's, or they're described as
dramatic,
history
like
on
as
it,
a woman
crazy.
It's like yeah
for sure. If a woman is just assertive, she gets called a bitch. Like it's always like it's amplified. So if you just have feelings, it's like, oh, the drama and stuff, right? Oh, you're using your tears to get your way. It's manipulative, and it's all. So we get taught we come from the factory with this range of emotions, and along the way we get taught like, well, you can't have these ones, you're allowed to, as a guy, I'm allowed to feel happy, hungry, horny, and angry. Like everything else is, like for the weak or some bullshit like that, pardon my language. So, group therapy, if those are the beliefs that I come from, or those are the systems that I come from, group therapy is not going to feel safe. Talk therapy can be re-traumatizing. So we do a lot of EMDR where you don't have to tell the narrative, and you can process these memories, so you get relief from the present day triggers that they bring up. So EMDR shows 3 things will happen with traumatic memories. They become less vivid, harder to recall, which means they're not going to be intrusive anymore. We get lots of reduction in nightmares, flashbacks, and intrusive thoughts, like pretty quickly sometimes. So less vivid, harder to recall, and less disturbing. We're not erasing memories. We're not making sad memories happy. What we're doing, people report a lot that the memories feel farther away. They feel less clear. They're a bit blurrier. And they just don't have that like gut punch kind of quality to it anymore. And if I don't have a gut punch quality to a memory, say, of being betrayed in the past, then I'm less likely to be triggered and feel less able to trust someone today. So we process the traumatic memories to help us deal with the present day triggers. And if I don't feel as triggered today, the chances of me running off and getting a bottle or a bag or whatever it might be are going to be a lot less, right? So it's relapse prevention by doing that trauma treatment as well, in my thinking anyway.
100%.
And then the internal family system stuff. Oh, sorry.
No. That's,
and there's actually addiction-specific protocols. Yeah. There's addiction-specific protocols where if I can go in the past and I can desensitize traumatic, painful memories, I can also go in the past and desensitize euphoric memories or the positive affect of using something. So if I go, oh, what I got from that was like confidence and all of it, we can desensitize that so that it's like I don't have necessarily super euphoric memories about using. Again, they become farther away, they become less vivid, a bit blurrier, and that then my triggers and cravings can be a lot less. And we can actually desensitize individual triggers. So, say I have a client who goes, well, I want to stop smoking. Like, okay, what are your triggers? Like, I don't really have any triggers. I just smoke. It's like, okay, so you wake up in the morning. That's a trigger. With your morning coffee, that's a trigger. After a meal, that's a trigger. Before you get in a car to go on a car ride, that's a trigger. Feel stressed out, that's a trigger. And then we use EMDR to individually target things like that. Or, if it's not smoking, they're like, let's say it's about heroin or cocaine or methamphetamine or whatever. It's like my neighborhood is a trigger, my family home is a trigger, my partner is a trigger, the stress work is a trigger, and then we can desensitize those so that they get less triggered when they go back into their environment. So there's like a lot of applications for it.
That's interesting, Mike. In our talk about EMDR in the episode we did about it, Lisa kind of dialed in on that, and she was like, "Oh, hey," but you never explained in that episode how that, like, why you're able to do that, and it's just the reverse of the trauma stuff, right? And I think that's just like, that's really cool and really neat. And Lisa, I know you got something to say about this whole line. So, and I'll be honest, that's kind of why I interrupted him, because I knew you got something, right? Something you want to ask.
Yeah. No, I just love it. I mean, it makes sense when he says it, but I've never, until I think it was the last time that we were with Mike, that this had come up. And, I was saying I was like doing the Ryan bounce, I was like, because it's something that I've just never heard about it. Like, I know people who do EMDR and ART, and it's always focused on, classic trauma. But it's like Mike said, the point is if you can utilize these skills and how they act on the brain to desensitize, then you can also desensitize euphoria,
Right.
because that's a huge thing, is that people can remember, and they it's rosy sunglasses, and it's got a fantasy element to it when people are in early recovery, right? It's like they're like, oh, but just if I could only just one more time feel that feeling. And so it makes so much sense to me, that, when Mike describes it, that, well, if we can desensitize the intensity of your memory around how good that felt, then that's going to decrease your desire to go back to it.
It just
I
seems
just
so
think it's
simple
the
once
most
now that
brilliant
it's been
thing ever.
said. It's like, oh yeah, of course, right? But you don't know until you know, right? So yeah.
And I've actually spoken to, there's a psychiatrist that I absolutely adore. She was one of my preceptors as a resident, and she does ART. And I was talking to her about this, and she said, she told me, now again, in the patient population she works with, it's not as many individuals with substance use disorders, but she said, yeah, she's the same thing, that there are protocols for it. And my hope is that more, if there are therapists watching this, if that's not something that you know how to do, man, go learn. Because I'm like,
no. Refer to Yatra. No,
refer to Yatra first.
no,
right?
I sit down with people all the time that have long storied histories of therapy, and have been to treatment and have done all that. And they go, oh, what's this EMDR stuff that you talk about? And it's like, well, it's been around since the 1980s. And so many people don't know about it, and all the applications. And I always kind of look at it and go I grew up punk rock, skateboarding, anti-establishment, kind of lowbrow, and it's like, well, let's do it dirty. It doesn't have to be the classic traumas all the time. It's like, where else can we put this stuff, right? Where else can we use this, if it works in these ways? And I think, we were talking before when we were talking about CBT and how we come up with core beliefs from CBT and how we then bring those core beliefs into EMDR, and we desensitize memories that support those core beliefs so we can get relief from the core beliefs. So there's so many different applications for it, that the other thing is, because we see people quite intensively compared to, if you go see a therapist, you're going to go maybe once a week, and it's going to cost you a couple $100. And you're going to, day one, you're going to do some history taking. EMDR is 8 phases. So you're going to do some history taking and some assessment, and then you're going to do some resourcing. And you're not going to get when you're not into the processing of traumatic material until weeks down the road. And by then you're like, well, I don't even know, why aren't we doing EMDR? That's what people always say. If you're not making their eyes move, they're like, why aren't we doing EMDR? Well, you are, but in an outpatient setting, you have to spend so much time resourcing somebody. But we have all these resources surrounding people, and we see them 4 times a week. So we can get into all these other applications in a more, it's just squished down in time. Basically, you take a year of treatment for someone and you just go, whoa, and put it into a month, right? And, it gives us that ability to work in ways that you wouldn't be able to do in an outpatient setting. And that doesn't make us better. It just makes us different, because the people that are working in those outpatient settings have all the skills and can do all the same work. They just don't have the luxury of being able to do it in a really intensive way like we do, which is why people seek us out specifically.
Mike,
and I think people get exhausted, right?
About.
People get.
Yeah. Sorry, Lisa. I want to jump on that for a second, because we were talking about other therapists and whatever. I don't want to attack anybody's way of doing things. However, I do have to say, when I've mentioned EMDR to people, half the time, and I'm just off the top of my head, might be less, might be more, half the time, the experiences that the people that have had experiences with EMDR have been the opposite of both what you've told me when we originally spoke about EMDR, my experience, and what you're talking about now. Right? In that it has been quite invasive to them. It has been, and it has not been a comfortable feeling. It's nowhere, nothing like the experience I've had. And we're not going to sit here and say that other people are doing it wrong. We're going to talk about how you're doing it, right? And to address that, why? So rather than talk about specifics, okay, why is it not like that for you?
I would just say one thing.
Right. Yeah. Okay.
Well, I would say because we maintain fidelity to the protocols. So in my experience, the first level of EMDR training that I did, afterwards, after you do it, you can start practicing it right away. And myself and a colleague of mine who's a psychologist from Australia, and now the two of us, we did the second level of training together. Then we did the master class and structural dissociation of EMDR, or of the personality, but using EMDR. We've done a bunch of like advanced trainings with it, and now we actually train psychologists in Australia. In the addictions protocols. So we've kind of come up together and stayed together through this whole thing. When we went to the second level, we were like, oh my God, we're not, like, we were practicing every day. Like, we had clients all the time and we were practicing EMDR every day. And we thought, oh, we're not going to know it as well as these other people. They're going to be so advanced compared to us. And we got into the second level of training, and there were like, the guy literally had to do a review of the whole level one, because there were people there that were like, gathering trainings, collecting trainings, but not actually practicing it. And at that point, I kind of clued in. I was like, oh, there's a difference between a therapist trained in EMDR and an EMDR therapist. And I think that it's very clunky at first when you start practicing it. You're used to sitting across from someone and going, oh, Lisa, tell me about your mother or whatever. And then you go, oh, well, I hate my mother. And it's like, well, tell me about that. Could you expand on that? Tell me why you hate your mother. EMDR, you don't do that. You sit very close in a thing that's called ships passing in the night. So literally, like, a client is a foot in front of me and just to the side of me so that I can like move my hand in front of their face. It's like a really awkward thing. The protocol is it's a very strict, scripted protocol that you stick to. And I think what happens is, because it's so counterintuitive to people that have been therapists for a long time, that you can actually collude with the client in avoiding doing the EMDR sometime, because you're more comfortable doing talk therapy because you've done it for a long time. And I've seen it happen, and I felt it in myself at times and been like, no, I'm going to stick to this. And I think it just comes down to practice. That's part of it. If you maintain fidelity to it. So EMDR is one of the most researched evidence-based therapies in the history of mankind. So what you're talking about is anecdotal evidence. That's a very small amount of people compared to the greater body of information out there. We know that it does the things that it says it does. And I would suggest that if you're not maintaining, but if you're not maintaining fidelity to the protocol for whatever reason, but that's also easy for me to say. There are also very complex cases out there. I've processed people's memories. Like, literally, someone comes to me and says, I have a memory of being sexually abused when I was a child. And by the end of 1 hour, when we get into the processing, like, they tell me the disturbance level around that memory is at 0. Like, that can happen in an hour, which to me, when I first started, was like, this is all bullshit. Like, I can't believe it. Like, they're just telling me what they think I want to hear. Like, I really was quite skeptical about it, but I keep replicating that. And it might be an hour. I've done 2 memories in 1 hour, but I've also done like 1 memory in like 6 hours. So, someone might not be getting the results that you had right away because the case is a bit more complex, or complex PTSD is also a lot different than PTSD, because if I'm processing 1 memory of, say, getting hit by my father, but I have 250 of those memories, processing 1 isn't going to give me the same amount of relief as if I was in 1 plane crash and then we process that. Like, it's very different. Like, you got to do the case conceptualization stuff about, like, what do we target first? What's the what are the orders that we target memories? And there is a thing called the generalization effect, where if I've been, say in 6 car crashes, if we process 2 or 3 of them, what happens a lot of time is the other ones we don't need to process, because like, we've desensitized that whole memory network around car crashes. So there's like, it can just vary so much, right? But I think my experience, as a therapist and working with therapists, doing consultation with other therapists and knowing about it, is a lot of people aren't very confident in it. And so they don't necessarily jump right into it, or they do like an eclectic mix with EMDR where they're not staying strictly to, they're not maintaining fidelity to the protocol. So they're like diverting a bit from it. And I think that would be my suspicion. is either it's too complex for a really fast result, and then people can get discouraged and go, well, I'm not getting the magic, or
somebody's just not
the person maybe just
right?
isn't, which is, whatever. If they've been a CBT therapist for 30 years and they're getting good results with CBT, they're probably going to revert back to their comfort zone because that's how they get good results. So I've seen lots of people that are like, yeah, I was trained in it, I never really did it.
Yeah.
So I was like, okay, I loved it, so I'm just going to do it all the time.
Listen, we are getting to a time cap here, unfortunately, because there's so much more we want to talk about, which means you're invited back, Mike. Right. Damn. You know what? I love these conversations.
Okay. Hey, man, I'll tell you.
You know what? I was going to say something, but I'm going to save it for my gratitude.
You invite me to a thing called the Ramble.
Right. You're like,
it's on you. You invite me to a thing called the Ramble. It's on you.
Lisa and I were joking once about how, like, you and I both have like really long text messages. Like we both ramble, right? Like you're my kindred spirit that way. So I totally understand the rambling, right? I absolutely do. So why don't we put a plug in it for now? I just peek behind the curtain. Lisa has a birthday party. She has to take my niece to. That's what we're calling her now, I guess. So we get to it, right? Absolutely. That's why we're going to cap the time on this one.
I know. Honorary Uncle Chris, as she calls him.
You know what?
Honorary Uncle's pretty good.
I'm going to speak to that really quick. As I cruise around and like, Mike, I don't know if you've had a chance to really check out the riverfront since you've been in Krabi, like to really go look and kind of explore down in there. There's that park. I was just at it yesterday.
On a long
with all those
boat
animals, statues, like animal statues. Have you seen that? Like, it's like this crazy. I was like, but every time I see one of these things, or there's a gecko running up the wall beside me, I think Alexis. Like, I there's like all the time I think about how cool it'd be to like be out here pissing around and rolling around at the park or whatever. You know what I mean? Like, I want to put her in the sidecar and watch her dad flip out. That's what I want to see. But anyway,
right.
Tell Alex I said that.
Yes.
Yeah. Anyway, brings us to my favorite part of the show. That's the daily gratitudes. Lisa, let's start with you. What you got for us?
This week, I'm going to say that just that whole situation with this friend of mine. It's just, I'm always grateful for this podcast. I look forward to this every week. I love this. I've made so many great friends through this podcast. And so I appreciate it all the time, but I think just feeling that extra appreciation and just so thankful to be a part of this podcast, just kind of highlighted with that experience, having a friend reach out to me and knowing that it is entirely and directly related to Ashes to Awesome. So I'm grateful for you, and I'm grateful for you creating this podcast and bringing really awesome people together and knowing that we are making a difference. It's awesome.
Amazing.
Mike, what you got?
My world is kind of small right now. I feel like super repetitive, but I've really been struck with some of the same stuff that I've been struck with the last few times we've talked. As we've moved from Phuket to Krabi into the new site, it's really started transforming. Like, we've had crews like doing renovations and stuff. Like, it was really intense at first, and now it's like kind of the end of stuff. But like, my staff has like really stepped up. They're just so committed and helpful. And here's one. We had a client who said, like, I know that you're renovating, because we said, look, like, we're like legit construction renovation, like, you'll have to come like in February. And she said, look, like, I only have 2 weeks off work. I can't, this is it. This is the 2 weeks I have. I understand that you're under construction. I don't care. I need the treatment. Like, the rest of it is all just bells and whistles. I don't give a shit. I want to come. She was our first client that we had at the new site. And at the end of it, she left us this card that was like unbelievable, saying, that it's been life-changing for her. And, like, and I look and I go, well, this is why we do what we do. Like, our staff, my wife, Chu, is like, Chu got the big shout out in the card for just making it a safe place. And this client said, like, I really want to thank you for allowing me to be here. You're making a really incredible place. that's everything it's supposed to be. And so I know like I'm not doing that. Like that is like this huge team effort. And it's really transforming and really turning into a place. Like we've got like a lotus pond happening now, and like it's a steam room and an ice bath that are like, yeah, it's turning out to be this amazing place, exactly how I envisioned that it could be. And I'm just grateful for everyone's input into it, because if it was left to me, none of it would have happened, to be honest. To be honest. So it's like Chu, my wife, and my staff are just killing it every day. I just am struck by like, oh my God, so grateful for them.
Kidding, eh? Well, I can't wait to come out and see the latest on it. Last time I was there, I was blown away by what was happening, and it's been a few weeks now. So really looking forward to seeing that, actually. Really
Smoothie on me.
Smoothie, yes. Ice bath, yoga, and EMDR, right? Let's make an afternoon of it right now. Anyway.
Yeah. Done.
Look at
Careful
that,
what you ask for.
Well, careful what you invite. Remember,
Well, you better
I'm just happy that somebody's
some
speaking English, man. Right? Like I'm like, fuck. Right? Like if I come, I might not leave. I'll bring a dog food with me, and like
I'll tell you. You bring some shorts to get in that ice bath. I will deliver a smoothie to you in the ice bath.
No.
On your way to yoga, and I'll throw in some EMDR to desensitize triggers for something like smoking.
That sounds like a date to me, right? You got me swooning, Mike. Yeah. Swooning, right? Absolutely.
Yeah. Yeah.
I'm
awesome.
grateful.
Jeez, am I
grateful. Yeah, I'm grateful for so much. My time here in Thailand has not been without its struggles, but coping mechanisms that I have that I didn't have before coming to see you over there was, they do help a lot. The breath work and so much more than that. Lisa, your call to me yesterday was like, that has been like sitting with me hard. So I'm gonna repeat your gratitude. Just the idea that like you got one person, and I know from my own experience that there's a few more than one that we've managed to impact, but whenever that one comes up, it's going to be the biggest deal, right? Because that's the one that's, it's the one that's in your face. And it's just like, that is so cool. That is so cool to think that 16 months ago, I'm homeless, shitty, hating my life, carrying enough fentanyl to kill myself, because that's the day, to this, to sitting here in a virtual studio with you two, getting a call like that. What else do I want for my life? Right?
Yeah.
It's absolutely amazing. So yeah, I got a lot to be grateful for. Yeah. Fuck. Almost made it through the episode. Okay.
Beautiful.
Even got me.
Beautiful.
It's amazing.
I don't have feelings.
Wins. Yeah. Cold.
I always love watching you and other people, get in touch with emotions when they're of gratitude. Like it really is like super powerful. And how do you feel more connected to someone than when they're like so authentic and real and feeling that stuff in the moment? So it's always beautiful to watch that. So
thank you.
And I'm really grateful to have. It was funny. I got to say one last thing. Lisa had said, I'm always grateful for the podcast and all that stuff. And I went like this. I went, oh yeah, this is a podcast. Like I forget, it's just this conversation that's so easy. And it's like, I'm grateful for that it's just always just seems like a beautiful conversation with people I enjoy talking to. And that's really cool.
Same.
Awesome. Yeah. Last and most certainly not least, grateful to every single person who continues to watch, listen, support. You guys, this is like, I never could have imagined. I think I just covered that quite well. Anytime you do any one of the things, subscribe. I'm supposed to say that at the beginning, and I never do. It feels too forced, so whatever. You know what to do. Do the like, comment, share, subscribe thing. Every time you do any one of these things, you're getting me a little bit closer to living my best life. My best life is to continue making a humble living, spreading the message. The message is this. If you're in active addiction right now, today could be that day. Today could be the day that you start a lifelong journey. Reach out to a friend, reach out to a family member, call into detox, go to a meeting, go to church, pray. I don't give a shit. Do whatever it is you have to do to get that journey started, because it is so much better than the alternative. And if you have a loved one who's suffering an addiction right now, you've just taken the time to listen to our Ramble, and it was a ramble. If you just take one more minute out of your day and text that person, let them know they're loved. Use the words,
you are loved.
That little glimmer of hope just might be the thing that brings them back.